Well, access to proper health care in the many rural townships scattered throughout Minnesota is a major concern for those who call them home. United States Senator Franken toured northern Minnesota today to listen to the myriad of concerns from health professionals and seniors regarding rural health care. Nick Minock reports.
As co-chair of the bipartisan Senate Rural Health Caucus, Senator Franken called on health experts in Duluth to discuss solutions on how to solve rural health care disparities. Catherine Sampson hosted the event. Sampson says there are 3 challenges facing rural hospitals and their aging patients.
Access, workforce issues, certainly, transportation. I think those are the 3 large ones, workforce being a very large one.
Sampson says attracting doctors and specialists to practice medicine in small towns is tough.
Well, I think that our small towns are struggling to attract residents. The wages aren't the same, the housing's not the quality, the cultural amenities, just the amenities of some of our small rural communities aren't the same as living in Minneapolis or St. Paul.
In addition, wages for medical professional jobs are usually less in rural areas.
Things are a little off kilter when these very skilled caring jobs are not, we're not paying people as much as we are for jobs that have much less responsibility and require less skill.
According to the National Rural Health Association, only 10% of physicians practice in rural America, despite 1/4 of the population residing in rural areas. But even outside of small towns, there is still a shortage in many medical fields.
We estimate we have 1,800 positions open in nursing homes statewide. Most of those are in rural Minnesota.
One of the ideas the Democratic senator says he'll be advocating for is student loan forgiveness.
Some of the solutions we're talking about is like loan forgiveness to make sure that people serve in rural areas, also to recruit people from rural areas to go to medical school.
In Duluth, Nick Minock, KBJR6 and Range 11.
Last year, Senator Franken introduced a legislation that would provide access to hospitals, doctors, and ambulance services in rural areas.